Welcome in, everyone. This is Chelsea Ward, Professional Outreach Coordinator for Foundation of Fighting Blindness. Thank you so much for joining our Seeing Beyond Vision Loss, a focus on mental health resources for patients with retinal disease webinar. So before we get started, I just want to briefly review a few details for tonight's call. All participant lines are muted and without video, but please be aware that all controls are at the bottom of the Zoom window. Now this control bar may collapse when it's not in use, but if you would prefer to prevent the controls from hiding automatically, you can use the following keyboard shortcuts. So if you're using a Windows computer, simply press the Alt key, and if you're using a Mac keyboard, press Command and backslash at the same time. Now tonight's presentation is being recorded and is available with closed captioning. So to activate closed captioning, please select Show Captions at the bottom of the screen on the Zoom toolbar. We will have a live Q&A immediately following the presentation. It is now my pleasure to hand over to Michelle Glaze, our Director of Professional Outreach.
Good evening, everyone, and welcome. As Chelsea said, I'm Michelle Glaze, Director of Professional Outreach for the Foundation Fighting Blindness, global leader in driving retinal degenerative disease research. I want to start by thanking our partners, Astellas, Genentech, and Johnson & Johnson for supporting this webinar this evening. I also want to extend a special shout out to military veterans of our U.S. Armed Forces this evening. Thank you for your service and dedication to our country. Happy Veterans Day. During tonight's presentation, you're going to hear from the perspectives of a patient, a retina specialist, and a clinical psychologist. The vision loss journey is a journey that unfortunately often starts with the grieving process. Many of us don't know where to turn when initially diagnosed with a blinding eye condition like an inherited retinal disease or age-related macular degeneration. For the eye care professionals on the call this evening, by providing a holistic approach to care for patients, you can really create an opportunity for patients to get on a path forward earlier in the diagnosis. That holistic approach allows patients to get support they need, guidance they need, and get connected to professionals that together can provide a team approach to care. And that can really change the emotional impact and the quality of life for patients as they go through their personal journeys with vision loss. I want to start by introducing our presenters for tonight's presentation. Jessie Wolinsky is a disability advocate, podcaster, and co-founder of Sight Club. She was diagnosed with retinitis pigmentosa at an early age. She currently is the host of Badass Blind Babe podcast, and she has more than 44,000 followers on TikTok, where she raises awareness about disabilities and vision loss. Sandeep Grover, MD, is a professor and associate chair at the University of Florida in Jacksonville. He is the director of the Inherited Retinal Disease and Electrophysiology Clinic. His research is focused on disease progression and the psychosocial impacts of vision loss. Dr. Grover has authored more than 150 publications and has been a longtime partner of the Foundation Fighting Blindness. Anne Wagner, Ph.D., is a board-certified clinical psychologist. She spent 26 years on the PTSD clinical team at Minnesota VA. She has vision loss due to retinitis pigmentosa as well, and is a very sought-out speaker and consultant due to her expertise in grief, as well as resilience and mental health as associated with vision loss. Without further ado, I'd like to turn the spotlight to Jessie Wolinsky.
Thank you so much, Michelle. Hi, everyone. I hope everyone is doing really well tonight. I really appreciate you guys taking some time on your Tuesday afternoon or Tuesday evening, rather. I'm in San Francisco, so I'm a little earlier, but I'm just really grateful that you guys are here. This is such an important topic and one that is very near and dear to my heart as someone who has a visual impairment and as someone who is currently in grad school at San Francisco State University studying clinical mental health counseling. I specifically want to, one day be like Anne and be able to be a psychologist and support people in the visual impairment community, because my life has really, really been shaped not only by my diagnosis of retinitis pigmentosa when I was 7 years old, but also from my diagnosis of major depressive disorder that I received when I was 15 years old. So first, I want to start off by saying that not every person who is blind or experiencing vision loss also experiences depression and anxiety, but the likelihood of someone experiencing these things is definitely higher amongst people with disabilities, but specifically for our blinding community. So for me, in my case, I was diagnosed with RP when I was 7, but my parents kind of really were the ones who dealt with the diagnosis more at that time. I just kind of thought that everyone goes to the eye doctor every 6 months, and all I really knew about it was I get a Hershey's candy bar after I go, so I was not sad to go at all. But I didn't really understand the severity of the diagnosis until I was about 13, 14, and my parents really educated me more about the fact that I would potentially be completely blind one day. And this was not anything that they necessarily hid from me, but it was, it's a very heavy conversation and very, very heavy news. And for me, that was before the time that I was thinking about getting my permit. And I truly took it as somewhat of a death sentence. I did not believe that I would be able to have a happy and healthy and successful life as a blind person. This was before I was involved with the Foundation Fighting Blindness. I didn't know anyone who was affected with a retinal condition. I'm also adopted, so it was not in the family that I was being raised by, and I didn't have any connection with my biological father, so my parents were really kind of thrown for a loop. And after I was dealing with this diagnosis as a teenager, I slipped into drugs, alcohol, and really experienced a lot of suicidal ideation. And it's very difficult to hold a lot of space for that, because I know now today that disability is not a death sentence, and I've been able to cultivate a lot of confidence in myself and in my blindness. But that was not at all the case, and that was not at all the case at the beginning, and it's something that I've very much had to work for. So for me as a patient, it's so important for me to help mental healthcare professionals reach out to clinical professionals as well. So eye care professionals, there is somewhat of I have a certain bedside manner that doctors kind of get a rap for. And I just have to say, in my personal experience, I've dealt with a lot of different eye care professionals, and there are certain attitudes and certain ways of talking about the disability and everything that's going on in a medical sense in a way that also supports the emotional experience. Because for a lot of people there, I've heard so many stories of other people who are affected by RP or other retinal diseases, where they go in and they get this completely life-altering diagnosis and they say, oh, there's no cure. We'll see you in 6 months. Bye. And people leave absolutely feeling like their world was turned upside down, and they don't have resources and they don't know where to go. And I think, unfortunately, there is a large narrative that people with disabilities don't have as happy of a life. There's a loss of independence. There's a loss of confidence. There's just an unfortunate view of people with disabilities. And I think that a lot of people internalize that. And I know that certainly I have over the years, and it could be really, really damaging. So one thing that has helped me a lot is I try to utilize certain resources in my everyday life that I know will help support my mental health. And those are things, of course, like exercise and proper diet. But I feel like even that in and of itself is something that is underutilized that could be referred to from a doctor's point of view. So when you're dealing with patients, not only are you wanting to obviously give them the medical, clinical information about what they're going through and their diagnosis and their body and all of that, but like being able to have your patient leave with resources and with tips and tricks and things that they can do to not only manage their blindness and the physical aspects of losing their sight, but really the mental health aspects. So like I said, exercise, nutrition, getting hooked up to a therapist, getting connected to resources like the Foundation Fighting Blindness. Truly, there is no other way that for me, there was no other way that I was ever going to meet other blind people in where I grew up, in a very small town. It was just not a very diverse place. So without the foundation, I don't think that I would have been able to meet other people in my situation. And as we know, we all need community. I feel like this is such an intense disability to have because it is one of the more isolating disabilities. At least in my case, I've spoken with a lot of other people who feel the same way. You know, the world is definitely not set up for people with vision loss. And the way that people can internalize that message of, wow, this world is not set up for me, maybe doesn't want me here. What value do I add? This can really be a normal thought process. And it's one that even today I wind up getting caught up in, especially as I lose more and more vision. And I'm very excited for Anne to go into a little bit more about like the grief, about what it's like to go into to what it's like to lose your vision, because it is definitely a grieving process. Every year I lose a little bit of my vision, and I'm constantly having to adapt to that and learn how to do things differently, accept the fact that I have to give up certain things. And it can definitely add some sort of effect to my identity. And I think that that is something that I'm constantly having to work out within myself and say, hey, I am experiencing this and it's very stressful. However, it does not have to be the overriding, narrative of my life that I experience vision loss. People with disabilities, people with vision loss, we are very multifaceted. And so I really, really, really appreciate all of you being here to be able to listen to my story and how I've viewed my vision loss in the past and how I've been able to change my view on vision loss and also on myself and my future through proper mental health care support. And so I really, really, really encourage you as mental health care professionals, you as eye care professionals, if you are in any sort of clinical setting with patients, just to really bring in as much of that comfort and that support. And if you don't know how to necessarily bring that, you can always look it up. And there's nothing wrong with being able to reach out to other people who might also be able to have ideas on how to help our clients, because at the end of the day, you don't want anyone to leave your office without resources in their hand and truly like hope in their heart that this is not going to be the end of their world. It might be a new chapter, it's a little bit different, there's an adjustment period, but there's that hope. And I definitely really just want to thank you all again for being here. Thank you so much.
Jessie, thank you for sharing your personal story and your perspective. And you're right, resources are so important and so impactful to the lives of people with vision loss. I'd like now to invite Dr. Sandeep Grover to hop on and share the spotlight. Tell us a little bit more about the holistic approach to care from the perspective of a retina specialist. Dr. Grover?
Thank you, Michelle, and thank you to everyone on the panel. Thank you to everyone who is here today on a Tuesday evening. Thank you for putting my slides on, Chris. So I'm at the University of Florida. Next slide, please. So financial disclosure, I just get some grants, and I'm a principal investigator for several trials in diabetes as well as inherited retinal diseases at the university. I'm a board member on a couple of things. I am a part owner of Ellie Mental Health at Ponte Vedra, which is run totally by my son. I don't get involved. And for full disclosure, I do not send my patients there. Next slide, please. So when I joined the University of Florida in Jacksonville in 2005, I started the IRD clinic, partly supported by a career development award that I received from the Foundation Fighting Blindness. And thank you. Over the past 20 years, I've had the privilege of meeting and getting to know many of my patients, wonderful individuals who have shared their smiles and tears, their joys and their challenges. I often feel that I understand what they go through, yet I also recognize that what I see is only the tip of the iceberg. And certainly, we cannot overlook the emotions and the strengths of their family members, their spouses, their parents, their children who walk this journey alongside them. So, what we wanted to talk about today is you all know that inherited retinal diseases, they cause progressive and mostly untreatable vision loss. And so, this is a psychological burden that is very substantial but often under recognized. We get busy with things and we don't go in that direction. So the aim is to look beyond the vision loss and highlight the mental health implications and practical clinical strategies that at least I use in my clinic to try to alleviate some of those things. Next slide, please. So just some facts before we get there. This is from the Public Attitudes About Eye and Vision Health. This was published in JAMA Ophthalmology in 2016, that people in the US fear losing vision more than memory, hearing, or speech, and consider visual acuity loss among the top 4 worst things that could happen to them. Next slide. In USA, more than 7 million people, this is based on 2023 Prevent Blindness questionnaire. There were more than 7 million people living with uncorrectable vision loss. Out of that, more than 1 million people were living with blindness. Next slide. So WHO in 2022 mentioned that the consequences because of the visual impairment, they are 3 times more likely to be unemployed, 3 times more likely to be involved in a motor vehicle collision, 3 times more likely to suffer from depression and anxiety disorders. Next slide. So of all the causes of visual loss, refractive errors, cataracts, and glaucoma, of course, being the biggest chunk of the causes, IRDs is probably a very small sliver in that others category over to the left. Next. So when we talk about inherited retinal diseases, they kind of fall into 2 big categories. We know that the rods and the cones are the cells that help us to see. So if the rods are involved, those lead to night blinding disorders where dark adaptation is affected and the sight vision is affected. Things like retinitis pigmentosa, syndromic RP like Usher syndrome, choroideremia, gyrate atrophy of choroid. And then if the cones are involved, that's pretty much the macula that is being involved. And when it starts at an earlier age, these are called macular dystrophies. Stargardt disease being the most common juvenile onset macular dystrophy. Then there is cone dystrophy, cone rod dystrophy, juvenile retinoschisis, Best disease, pattern dystrophy. All those cause degeneration of the macular area and of course affects the center vision mainly. I did put achromatopsia in that category, although it is not a dystrophy, but it affects the macula. Next slide, please. So how do these conditions impact the quality of life? Well, loss of independence is a big thing. A lot of these conditions, people cannot drive anymore at some point. There's a problem in reading books, looking at cell phone, looking at computer monitors, career opportunities. They have to decide about their careers based upon what they can do, and the unknown in the future that whether they will be able to continue in the career that they select. And all this leads to an emotional distress, which starts very early in life. And there is a progressive vision loss. And on top of it, as of yet, there are not too many treatment options for these conditions. Next. If you look at literature, there is extensive work, extensive publications on mental health correlations with age-related macular degeneration or cataracts or glaucoma, which are the conditions that usually affect in the later part of life. So they have already had their careers, they have already had raised their families, they've seen their children grow, they're seeing their grandchildren grow. But there is limited research on mental health impact in inherited retinal diseases, which starts much earlier on, usually in the first decade of life or by 20s. A lot of these conditions, these people could be legally blind. Next. So we did a study with my counterpart in Gainesville, Dr. Chen. So we looked at 38 patients with RP to analyze the quality of life in patients with RP. And we did a questionnaire with demographics, vision-specific questions, family, socioeconomic status, health insurance, healthcare resources, disability resources and transportation, social support, personal care, and well-being. Those were some of the questions that were included in the questionnaire. Next, please. And of course, the depression was self-reported in the questionnaire. And we found that in these 38 patients, about half of them had depression in one form or the other. And the conclusion from that manuscript was that it correlated with visual acuity being 2200 or worse, which is the legal blindness cutoff vision-wise. And living alone was another factor that correlated with depression. It was not related to education level or the unemployment rate, as has been reported in some other studies. Next. We did another study here locally in Jacksonville, and we looked at 43 patients with retinitis pigmentosa. Here, we did a questionnaire, but these were standardized questionnaires to actually measure the level of depression, the level of anxiety, and what was more important, we looked at resilience. And then we, of course, looked at visual function to try to correlate it with all three of those. Next, please. So this was the questionnaire for the visual function, and in the middle you can see that there were 4 out of 25 questions that actually deal with mental health. Next. So what we found here was that about 1/3 of the people were taking medications for anxiety or depression. Majority of these patients were in the minimal to mild depression range, and none of them met the criteria for severe depression. What was notably different or interesting was that resilience was noted in about not 80%, but this is a scale. On a scale of 0 to 100, they were at 80. The general resilience in the US population is 79. So the resilience was pretty high. There was a non-significant trend that suggested that greater understanding or education about their condition correlated with higher resilience. Next, please. So, what is my approach to psychosocial care? 3 E's: inquire, educate, and empower. So, I try to inquire or ask about anxiety and depression. And it may not be a straight question, are you depressed? That's not the way it should be done. Usually we'll start talking to the patient about how they spend their time, what is going on at work, what kind of work they do, and then they will slowly tell me about it and share things about how they're anxious or depressed and whether they're on the medications or not. Educate them about the course of the disease, the prognosis. So, for example, in retinitis pigmentosa, you heard Jessie talk about how they have been told that this is a blinding disease. And that's what I heard when I was doing fellowship in IRDs. So we decided to look into this, and there are two studies that we did, and we looked at the vision for 2,000 patients with retinitis pigmentosa, and out of that, only 6 people out of 2,000 were totally blind in both the eyes, meaning being in the dark. But the rest of them had some vision. And so I make it a point to tell all my patients with retinitis pigmentosa that total blindness is very rare. Of course, they can be legally blind earlier on in life. Educate them about the genetics, some genetic counseling, empower them by telling them about ongoing and future treatment trials, involvement in the support groups. Next, please. So I helped to start the Jacksonville chapter of Foundation Fighting Blindness with some of my patients' family members, and they do a tremendous job in running this. And I can refer all my new patients to the chapter so that it provides a social platform for them, as Jessie was alluding to, that there was no one to talk to, but the community chapters like Jacksonville chapter helps a lot in that way. Next, please. These are some of the amazing people from the chapter. Next. And as you know, this is a multidisciplinary approach. Everyone is involved in this, all health, eye care professionals, optometrists, ophthalmologists, retina specialists, pediatric ophthalmologists. And we should not forget genetic counseling, low vision specialists. If the vision is less, refer them to low vision specialists, psychotherapy programs. Next. So this is what I do when a patient is referred to me. There is an initial visit where the usual history, family history, I do the pedigree charting, vision, refraction, color vision, just the usual stuff. I do a wide angle color photograph, wide angle autofluorescence on Optos, and spectral domain OCT, not only for documentation purposes, but also I use these pictures and I show the pictures to the patients when I'm talking about these conditions for the first time, telling them the diagnosis, because the visual impact is much more than me just telling them that you have pigments in the retina. But if I show them the pigments, it has a much more impact. Next, please. And in the initial visit, we discuss about the course of the disease, prognosis. We talk about gene testing because there are so many trials that are going on for gene therapy. So gene testing, which is thankfully provided free to the patient with this My Retina Tracker program from Foundation Fighting Blindness, that has been a blessing. And all my new patients now get gene tested. For the last 6 years, they have all been gene tested. Referrals, if needed, to a low vision specialist, the Division of Blind Services. So we have a local Florida Division of Blind Services, excellent resource. Introduction to the FFB local chapter for social support. Refer them to a psychologist or counselor only if needed. Next. And then 2 to 6 months later is the second visit, which is I usually do a Goldman visual field, ERG, and then we discuss based upon that because the gene test report is back by
And
then.
pardon the interruption, Dr. Grover. We're just coming close on time.
Yeah.
Kindly wrap it up. Thank
Wrapping
you.
up too. Thank you. So we discuss about the genetics, the driving issues, use of cane, protection against UV light, blue light from the sun, treatment trials. And if patient qualifies for some treatment trials, we set up an appointment for them to come back for screening. And then I usually continue to monitor them every 6 months or 1 year, but have the referring provider take care of rest of the eye conditions. Next. So my slogan is no IRD family left behind. Next. This is just a pilot study that we are doing with the clinic in Ponte Vedra. So what I'm trying to do is setting up a curriculum for a mental health counselor and educating them about the list of daily living skills, the diagnosis that affect the central vision and peripheral function, because this would enhance the understanding and improve the counseling for individuals with visual impairment. Next, please. And thank you for listening.
Dr. Grover, thank you so much for your dedication to patients with inherited retinal disease and for providing an overview of your protocol for providing care to this patient population. Very important information. Thank you for sharing. We're now going to turn things over to Ann Wagner. She's going to talk about emotional impact of vision loss and how mental health services can support the vision loss community. Ann?
Hi, it's so good to be with you, and thank you for being here. First, I just wanted to share that my mom had autosomal dominant retinitis pigmentosa. It ran in her side of the family, and of her 5 children, 4 of us inherited the RP. So I grew up in a blind culture and just wanted you to have that kind of personal context as I go through my slides. And I can't actually see them. This is all in my head. And I have my husband here as my sighted helper. This is Eric.
Hello.
Hi. And if I lose track, he's here to help. And I'm also going to have him read a quote in one of the slides in just a little bit. So I want to start off. Is my first slide up? The personal and emotional.
Still your title slide.
Okay, next slide.
And
Okay.
bio slide.
Next slide.
There you go.
Okay. So the Centers for Disease Control and Prevention summarize some of the personal and emotional effects of vision loss, and they include physical health due to falls and injuries, quality of life for many, many reasons, including lower rates of employment and mental health. People with vision loss tend to be at higher risk for social isolation and loneliness, worry, stress, and fear. And the CDC estimates that 1 in 4 people with vision loss are at risk for clinical levels of anxiety or depression. There's certainly some studies that have higher rates and some a little lower. It kind of depends. But the CDC definitely recommends mental health screening for people with vision loss and connecting people to mental health services as early as possible in the adjustment process to help preserve and protect quality of life. Next slide, please. So I wanted to share also some factors that might increase that risk for anxiety or depression for people with vision loss. And certainly we know loss of independence, which can affect a person's sense of self-worth. The social isolation, loneliness, social withdrawal can undermine emotional stability. The fears of becoming a burden and the vulnerability when needing to ask for help. The risk of falls and the fear of falling. We know that older adults with vision loss are at higher risk for falls. And in fact, Eric's father, who had pretty significant macular degeneration at 78, fell and died 2 weeks later due to complications of that fall. So it's a real concern. Certainly employment concerns as well as social stigma, which can contribute to the marginalization and misconceptions about people with vision loss, and that can affect kind of that internalized sense of lower self-worth, self-esteem, and lower self-confidence. Next slide. So what can you do to help? Helping facilitate referrals for mental health care, helping facilitate referrals to low vision specialist care or state services for the blind, or all of those resources and programs that help learn the practical skills of adjustment, the orientation, mobility, technology, all of those things, and encouraging continued social engagement and support groups. I like to use a metaphor of a stool with 3 legs. One leg is the eye care providers, the retinal specialists, the genetic counseling, everything related to the eye care, the disease process, treatments, all of that. Another leg would be the low vision resources, the orientation, mobility, the technical training, and all of that to help us learn the practical skills to live our day-to-day more independently. The third leg is the emotional and psychological supports. And that could definitely be a referral for mental health therapy, psychiatric medications. Those emotional and support needs could be met by family and friends, depending, but not everybody has really supportive, good listeners in our relatives. You never know. But having a dedicated therapist who's there to support with privacy and confidentiality there just for our emotional and psychological needs is really powerful. Support groups can serve that leg. I do want to say adjustment counselors that are part of a lot of these rehab programs where we learn the orientation mobility are wonderful. They definitely can help with some of the emotional aspects, but they're not trained mental health providers. They're not trained to treat the anxiety and depression, but they can be wonderful. So I want to share that my mom, the adjustment counseling she received through State Services for the Blind, that was all she needed, along with all of the support from friends and family. And the three of us, with the RP of her children, three of us actually needed some separate mental health care along the way, even with those same natural, wonderful supports. And I had excellent adjustment counselors, but I needed a course of therapy at some point to address some of the mental health effects. And it's incredibly helpful. So next slide. So some potential barriers to accessing mental health care. There are many, but I wanted to highlight just a couple here. And one is a misguided assumption that mood will improve once a person adjusts and gains confidence in using those practical daily skills that they're learning through their low vision resources. It is a misconception. It's just not enough for a lot of people. And another potential barrier is a shortage of therapists who are trained or have experience working with people with vision loss. So I just wanted to highlight those potential barriers. Next slide. So these are some ideas for eye care providers to just think about at the time of that visit where there's the initial diagnosis of a vision loss condition. So there are different levels of stress response, and the higher the stress response, the more impaired our cognitive functioning becomes. It's harder to take in information, to comprehend it, let alone remember it. And the eye care provider might want to share some really helpful education, but the person, after receiving the diagnosis, may not be able to take it in. They're mainly going to be concerned, is there a treatment? Because that's where they're going to anchor hope right away. Is there a treatment? And if there is, they're going to probably calm down a little bit. If there isn't, their stress response can get even higher. So just recognizing and developing your own system of how do you follow up with somebody, whether you arrange for a follow-up visit in a day or two or a week, whatever works for that client, to review the information again, provide it to them in writing, hopefully in accessible format, if like through my chart, so they can use their own Zoom functions if they're already experiencing low vision and need some help. But just recognizing they may not remember a lot of what's said if they're having that stress response. And another point is just a little compassion goes a long way. A simple acknowledgement of this can feel overwhelming, and we don't want you to feel like you have to do this alone. There will be people and resources to walk alongside you as you choose to invite them along the way, and we can be here to help you with those referrals. And just mentioning that having a dedicated like therapist who's there just for them can be really helpful for people. It doesn't mean we're insinuating that we think they're going to have anxiety or depression. Unfortunately, there's still some stigma, but I think it's getting better and better. That people seeking therapy are viewed more as they care about themselves and they care about their well-being, and it's viewed more and more as a sign of health. And of course, encouraging that people connect to low vision specialists, even if they're only experiencing a minor level of vision loss at that point. I think there's some research showing it's really helpful that they could get connected sooner, have a positive experience with maybe learning how to use a special magnifier, something like that, can then increase their hope for the future that there will be services as their vision loss progresses. And then I think it's just important to understand the complexities of the grief, because even if somebody is adapted and they're using all their practical skills, there's still this profound grief and loss. The emotional world of vision loss is big, or can be big. Maybe not for everybody, but for a lot of people it is. And it involves grief and loss related to time, energy, focus, resources, other people's time, and all the attached meanings and ideas, living in a world that's dominated by sight and a future where they had hopes attached. It's a lot. Next slide. So an often unrecognized part of the grieving process is time, and the sense of it's a loss of flexibility of time, of how we choose to use our time. We all have preferred things we'd like to do with our time. Like I would like to make scones and spend time with my grandsons. But when I've experienced another progressive loss of vision, and I know I'm having to learn or relearn some practical skills or a new software system or something that takes time, I grieve it. I grieve needing to make that decision, and that's probably what's weighing heaviest on me these days is time with the adjustment that's needed. I have hope. I know I'm resilient. I can get through it, but it's just an important area to recognize. And also recognizing that in the process of grieving, there's times where just being with the emotions, validating them can feel sort of exhausting. And people might not have the energy or focus or even want to actively seek out new ways to do things. And it's important to validate when they need time just for themselves and for the emotions. And other times we're ready to go and wanting to learn new things and new ways to do things. Next slide. I'm going to ask Eric to read this quote by Dr. Ruth Williams. It's from an opinion piece she wrote for iNet magazine that I just think was wonderful and wanted to share with you tonight.
There's more to offer our patients with vision loss, even those who have mild and moderate loss, than evidence-based care, procedures, solutions, and referrals. Simply acknowledging their vision loss is powerful. Grief counselors teach that people experiencing a great loss don't need advice or platitudes, but rather they need someone to listen and to create a sacred space for their grief.
Next slide. So the sacred place for their grief is where I think of the ideal kind of therapy course, a place that isn't too manualized, but allows a space for the client to share their story. And this slide is some ideas of what I think are important for any course of therapy, regardless of modality. So this might be something for mental health therapists to consider, but also for all of us just to have an awareness of these points might be important in a course of therapy. So the first point is addressing and processing all of that complex grief and all of the emotions. And there's many that ebb and flow as the vision loss progresses. Inviting in the client to identify what are their own beliefs, meanings, and ideas about living with vision loss. So what are their personal thoughts and ideas or narratives, and exploring those with them. Encouraging social engagement and continued involvement in valued activities that can help a person preserve their core sense of identity. What matters to us still matters to us. Our values are still ours, and trying to stay connected. Recognizing that some social withdrawal may be a natural part of the grieving process. If it ends up being prolonged, and again, each client gets to determine if it feels healthy or not, but in general, prolonged social withdrawal tends to increase risk for depression. Recognizing that self-advocacy can be important, and inviting the client to kind of explore for themselves what are their ideas for how they would most want to show up as they express their needs to others. And another point is always prioritizing the client's personal agency and their preferences. What do they view as a problem or not? What are their narratives? What are their ideas for their own resiliency? What do they want to claim? What do they want to stand against? And then lastly, I think everybody working with people with vision loss, I think it's helpful to be aware of the phases of adjustment and the theory outlined by Tuttle and Tuttle in their text from 2004 called Self-Esteem and Adjusting with Blindness. The Wisconsin Department of Health Services website does an incredible job summarizing those phases of adjustment and the role of the professional at each phase. Now, the role of the professional is they're usually referring to the rehabilitation adjustment counselors and the people involved in their Office for the Blind and Visually Impaired program, but it certainly is relevant even for mental health therapists to be aware of those phases. So for your convenience, I have copied and pasted from the Wisconsin Department of Health Services website the phases of adjustment in a separate PowerPoint document that will be made available to you if you would like to review those. And I'm not plagiarizing. I'm letting you know I copied and pasted them verbatim. So
Just about 15 minutes.
okay, next slide. So this next slide is also a handout available to you. It's the next two slides. And this is a list of support resources for people newly diagnosed who have an existing diagnosis that you can use as a handout. You can give to your patients if you think the information on the handout is helpful. So it's available to you as well. And so first is, of course, encouraging people to look into their local low vision resources, state services for the blind, low vision specialists to help address those practical needs. But then the rest of the handout are kind of national resources that offer some emotional and social support options. So FFB is right up there because they now have a mental health resource center on their website, and they have therapists listed who have completed at least 4 hours of specialized education regarding working with clients with vision loss. They have a lot of helpful education, and they have chapters in 48 states that can help with that social support, that sense of community. And I can't tell you enough, I miss being around my family. And when I started attending the chapter meetings, I felt like I was with family again, and it just meant so much to me. So next slide. I've listed hadleyhelps.org. So Hadley is also, it's a free nationwide online resource that is really centered on both helping people with practical skills through podcasts and little online workshops. I shouldn't say little, it's incredible what they offer, but also the emotional and social supports. They have a peer-to-peer connection program, support groups, and their help desk staff are trained to understand how overwhelming it is, and they are trained to listen. Healing happens in relationships when we feel deeply heard with our stories and our experiences. So these staff are offering healing moments by taking these calls and just listening. And they understand it's important to not bombard people with telling them, oh, you could do this, this, or this. We have all these resources. They simply say it's one step at a time, and we'll help you collaborate on what's the next step that feels helpful to you. Okay, so there are other national resources listed that can be very helpful as well. So for the sake of time, I'm going to turn it over to Q&A.
And thank you so much, and Eric. Thank you both so much. And it's so wonderful to have your unique perspective, right? Both as a patient and as a clinical psychologist. And thank you for painting such a broad overview of what's out there and available from the emotional support standpoint, mental health standpoint, and resource standpoint for patients with vision loss due to a blinding eye condition. Now we're going to open up for questions. Chelsea, I believe that you reviewed all of the ins and outs of how to ask a question at the beginning, so hopefully everybody remembers that. Chris, do we have any questions in the chat?
Hi, Michelle. It's Chris Adams. Yes, there is one, and you can probably address. Dr. Wagner talked about some local therapists experienced with working with blind and low vision patients. And if you can share where folks can find some of our licensed therapists that we're working with.
Yeah, on the website, the FFB website under the mental health resource, there's going to be I think on the slide, there's a tab with a link on the slide itself, and it's on the handout that I'm providing you. You can connect to that to see the list of the therapists by state. Not all states have therapists yet, But full transparency, I'm also currently serving on the Mental Health Advisory Council for FFB. And I know our mission is to try to continue training to add more therapist names, but that's down the road. Chris would know more than I do how many names are on there right now.
Yeah, that's correct, Anne. And we have probably about 95 therapists that are listed on the mental health resource site. We've partnered with ALMA. They have a network of 25,000 therapists. Within their network, they also have about 225 therapists who have completed the training.
And I just remembered, I forgot to say, or I felt rushed, like I need to finish talking, but Hadley Helps, those help desk staff will help people connect to their local mental health providers. They will help do the search if there's a caller that needs mental health connection. So if you're an eye care provider and you just know that's just not something up for the bandwidth of your clinic or the time you have with patients, that Foundation Fighting Blindness, getting connected to the chapter, or Hadley Helps, just calling that help desk to get the ball rolling. But also the vision loss resources, the rehabilitation programs, often those staff are very adept and know what kind of referrals, if somebody needs additional mental health care, they can help facilitate that as well.
Perfect. Thank you, Anne. If there are any other questions, please feel free to type those into the chat, and Chris, let us know if there are any additional, or you can come off mute.
Yeah, Michelle, there's one more. So this one came in. I'm a genetic counselor working primarily with pediatric patients. Are there any recommendations for how to support parents through a new diagnosis in their child, or how to provide support to children as they age and understand their diagnosis in different stages of life?
So, Anne or Dr. Grover, can either of you help address that question?
And you want to go first?
Well, I was just going to say that parents would probably benefit from a therapy referral to help with their own grief. When I've spoken at conferences like the Bardet-Biedl syndrome conference, it was heavily attended by parents. And the grief, and we had some breakout sessions where they could just ask me questions, and there was a lot of tears, and just listening to their stories and recognizing their grief is so much of it is we get attached to ideas as much as we get attached to people and to things. And when reality is telling us that that attachment will not be supported and we have to detach from it, that's grief. And so they had all these hopes and dreams for a child with vision, and they need to grieve that. And the tricky thing is a parent if they seem sad all the time around their child, they're sort of missing out on seeing how wonderful their child is, like what they have. And so I just think family therapy, recommending that the parents seek therapy, and any child psychologist, I know they're scarce and it's so hard. And I just love children, but I didn't go into that field. I worked with adults. Just seeking out as much as you can. Maybe you're, what am I trying to say?
Pediatric.
Yeah, their provider, medical provider might know of some child psychologists. Dr. Grover, what are your thoughts?
No, I would just like to add that you're absolutely right. It's not only the child, but also the parent that we look at. And I always, of course, if it's a younger child, I'm mainly talking to the parent, but I also make sure that I'm talking to the child as well in a language that they can understand to that level. Because many a times when I ask all children, do you have any question at the end? And many times they have just spurted out saying, am I going blind? And so that is always on their mind. And if they don't ask that question, I address that question, that you are not going blind. I want you to understand that. That not only helps the child, but it helps the parent also in many, many ways. It provides more hope and optimism.
Yeah.
Thank you both for your response. Thank you for the expertise there and insight for that particular question. Chris, I think we might have time for one more question if there are any others in the chat.
Sure, we have one in the chat that came in. Are there also therapists in the field that work with family members, spouses, partners of those who have an IRD?
Anne, we'll throw that one back to you.
I don't know that the ALMA therapists who were trained were, I'm sure I think the training didn't recognize that partners and family members also experience grief and have emotions, but I am not aware of any therapists specifically trained to help the care providers, other than that every mental health provider should have capacity to recognize family systems issues and issues related to people serving in a helper role and the dilemmas that can show up. I do think couples therapists and licensed family and what are they called? I'm blanking, sorry. Licensed couples and family therapists who have more of a systems view, even if they're not working with the whole system, might be a really good potential resource until we can have more people trained across the country. So.
Yeah. Thank you, Anne. And, with the right team approach to providing care, I think the whole family can receive support from their medical professional, their mental health professional, low vision services, and and even the genetic counselors in situations where people are receiving genetic testing. So sometimes that's okay. Sometimes that holistic approach, I think, can help the entire family unit in addition to just the patient. Go ahead.
Yes. Sorry, I interrupted, Michelle.
No, you're fine. Yeah, go ahead.
I just thought about all the support that happens at the FFB chapter meetings. Is that Eric and I do presentations for different ones, local and some other ones, and he shares a lot of the perspective of being the sighted helper and the dilemmas that happen. And we get feedback that the people attending who are the other family members, they're not the ones with the vision loss, they feel the validation when their issues are addressed as well in a lot of these conferences and meetings. So getting involved in those chapter meetings, like the FFB chapters or any of the national organizations, I think many have state chapters as well, can offer that support also for the people providing a lot of sighted help. We like the term sighted helper, but yeah.
Great. Thank you so much. I want to first of all thank all of our presenters. This has been just a wonderful presentation, just such a wealth of information and expertise. Chelsea, if you'll go to the last slide. If you'd like more information about the Foundation Fighting Blindness resources that are available to the eye care community, there is a QR code up on the page that will drive you to Foundation Fighting Blindness website, which is at fightingblindness.org, and specifically to the For Eye Care Professionals tab, where you can find additional information about no-cost genetic testing, no-cost genetic counseling, an inherited retinal disease patient registry, clinical research underway, local chapters throughout the United States and beyond, and also a link to the Mental Health Resource Center. So there's a lot of resources for the eye care community on that page. If you have any questions additional to what has been asked tonight, please feel free to email us, either mglaze@fightingblindness.org or po@fightingblindness.org. We will do our best to answer your questions. We appreciate our valued partners, Astellas, Genentech, and Johnson & Johnson. And thanks again to everyone for joining us this evening. Have a great evening.